The Privacy Commissioner's Office released a scathing report this morning about the 2021 cyber attack on the province's health system. It says the province, 3 health authorities, and the Centre for Health Information broke privacy laws. The report also says officials were warned about security problems more than a year before the attack, but failed to fix them. The CBC's Heather Gillis is live from our newsroom with the details. Heather.
Well, Carolyn, in 115 pages, this report makes 34 findings and has 6 recommendations specifically for the new provincial health authority. Now, the report also says it's likely that attackers stole sensitive information from the vast majority of people in this province, data which should have been better protected. In a report released today, the Privacy Commissioner's Office says nearly everyone in the province has had their privacy breached in the 2021 cyber attack on the health system. Former and current employees at 3 health authorities, anyone who had a COVID test or special blood work. Sean Murray investigated the attack.
It definitely would be hundreds of thousands.
With 200 gigabytes of data snatched, he calls it one of the worst cyber attacks in the country's history.
This information was taken by criminal cyber attackers.
In late October 2021, the Hive ransomware gang took down the province's healthcare system. It delayed thousands of appointments, sending healthcare workers back into the dark ages using paper without digital access to medical files. He also says the Centre for Health Information warned government the risk and impact from an attack was high more than a year before hackers hamstrung the health system, but they failed to fix it.
In other words, the ransomware attack against our public health information systems was a foreseeable event.
Those involved in the attack.
Something then Health Minister John Haggie dismissed.
And I received a threat assessment which highlighted no red flags. So that was in September of 2020.
The hackers snuck into the system, likely through a phishing email in mid-October, stealing legit credentials to access and siphon data, says the report. Murray says alerts were triggered at the Centre for Health Information before the attack was detected, but says the centre failed to respond and hasn't given him a justified reason why. The province and Centre for Health Information wouldn't confirm the attack was ransomware until March of this year, a 500-day delay. Murray calls that concerning. He says they broke privacy laws by not telling the public at the first reasonable opportunity in November 2021.
The Department of Health and Community Services took a leading role in what information would be disclosed and when, and it did not provide an adequate response to our questions to justify the delay in publicly disclosing certain details about the cyber attack.
Also concerning, he says, it took the province days to confirm data was stolen rather than merely accessed. He says health authorities, too, broke privacy laws by collecting some patient social insurance numbers which were stolen. Health authorities also didn't have proper records management, holding some former employee data going back to 1993, which should have been deleted, Murray says. He says the risk of misuse of the stolen data remains high, even though the gang behind the heist has been dismantled since January.
There were a number of instances where the Department of Health and Community Services did not answer our questions, and there were instances where the Centre for Health Information also didn't answer our questions. So that was concerning.
Meanwhile, Murray says official investigations into the attack were reasonable, but he recommends a chief privacy officer position in the new provincial health authority. He also says new cybersecurity projects should be properly resourced and implemented in the time planned.
Cybersecurity is and will continue to be an ongoing arms race with organized crime as well as state-sanctioned actors who will not only attempt to extort us and breach our privacy, but also cause us to incur significant costs to the public purse and harm actual health care delivery and other public services and critical infrastructure, potentially putting lives at risk.
The province still hasn't said if it paid ransom to hackers, and Murray won't say if that was the right move or not.